So I'm here to discuss fecal microbiota transplantation in GvHD. So in the past years, there is accumulating evidence that microbiota plays an important role in allogeneic stem cell transplantation. And we know that the microbiota is exposed to many types of injury during a transplantation and after, for instance, mucositis owing to the conditioning regimens, exposure to antibiotics, and even GvHD by itself can target the gut, and because of that, the microbiota is also injured. This has led to research on the field that first found that reduced microbial diversity in the gut is associated with a worse outcome or adverse outcomes following transplantation. And we know that a healthy microbiota is a diverse one, is a rich one. We have various genus there. But this has only been studied as an association. And the future is actually targeting the microbiota itself, trying to manipulating it. The first group that actually tried fecal microbiota transplantation for the treatment of acute GvHD came from Japan. It's a study published by Katihana at Blood at 2016, where they took a very severe, a very difficult to treat population with steroid-resistant or steroid-dependent acute GvHD of the gut. And we all know the poor outcomes this population suffers. And they administered between 1 to 2 infusions through a nasoduodenal tube of fecal microbiota from healthy donors. And surprisingly enough, 3 out of the 4 patients achieved a complete response, and the additional one had a partial response. So this was rather surprising, and more importantly, there were no serious adverse events. Later on, an Austrian group by Spindelboek, I hope I'm pronouncing his name correct, published in Hematologica in 2017 another series of 3 patients, again the same population of steroid-resistant acute GvHD, where they done the transplantation through colonoscopy, and they could give up to 6 transplantation, and all 3 patients responded. So these are the published trials. There are a few other, there is another abstract by the Heisenberg from Holland, and we are waiting the results. I think that there are several major issues in fecal microbiota transplantation since it's an evolving field. First, we must assure the safety of our patients, since, of course, stem cell transplantation recipients are highly immunocompromised, and we are not sure what are the short-term and long-term implications of giving fecal microbiota transplantation in this population. It has been shown to be safe in immunocompromised patients, oncological patients, inflammatory bowel disease patients. But still, I think the population we are treating is rather unique. So I would first say that safety is a most important outcome. It seems safe from what we have. There is a recent trial published by, or study by De Philippe from Dana-Farber, actually showing that fecal microbiota transplantation with capsules soon after a neutrophil recovery after transplantation is safe, but still we need more data. I think a second point, of course, is to establish the efficacy. The first target that we had was, of course, treatment of steroid-resistant or dependent acute GvHD, but it seems reasonable to actually move it a bit earlier as a prevention strategy. And I think the third point is actually trying to elucidate the underlying mechanism by which fecal microbiota transplantation works. So I think fecal microbiota transplantation will have a future in stem cell transplantation, and we are very much looking forward to that.